Dr. Piskin, I have a question.
Sure.
Now, when people have gum disease, dentists keep making one of the major problem of the gum disease the fact that you will eventually, be it a year, 5 years, whatever, maybe more, will lose your teeth. Slowly, 1, 2, 3, because of that you lose more, and the chances are highly that you're going to lose all your teeth. And that seems to be a major, major problem. And I'm not disagreeing that that wouldn't be a problem. But, as you have clearly mentioned yourself, we're pretty good, you dentists are pretty good in replacing teeth with implants and all kinds of stuff, and they become as good and more beautiful. And there's probably some very rich people out there who only have implants in it, even though they didn't need it, they just wanted to them more whatever. Do you know what I'm saying? A la Tom Cruise. I'm not saying he has all implants, I wouldn't know, I'm just saying. Do you know what I mean? Okay, now, so bad thing, but I have also heard that, and it makes a lot of sense to me, that because you're losing the teeth, you're having an infection, you're having that yellow, reddish pus in your mouth. You know, like when you get an infection, you cut yourself on the hand, and it gets all yucky. Well, that seems to be sitting in your mouth, which seems to be the gateway of your blood vessels, meaning minute by minute, that yellow, ugly pus poisons your body. And it has been apparently proven that, apparently, you tell me, that ladies who are pregnant get premature births, their babies are underweight. In fact, in California, there was a baby stillborn because they found the gum disease garbage into the placenta. And all kidney failures, heart failures, strokes, everything is associated with it. It looks to me, never mind the missing teeth, at least they can be replaced. Never mind the smelling you probably have for years, which you probably can't get rid of, the bad breath I'm talking about. But you're poisoning your body. That must be more devastating, more difficult, if not impossible to repair. Shed some light on that. Am I way off here?
You're not off at all, and the literature is constantly coming out, and even the local news stations and national news stations have broadcast reports for a while that gum disease is related to other diseases in the body, and the gateway to the mouth, to the body, is the mouth. And there is a sewer in there. There's always naturally causing bacteria in the mouth, but there's a lot of bacteria that are associated with gum disease that are in the mouth. The patients have no idea that they have this, and other symptoms are coming about, and they've done autopsies of heart patients where they found that coronary artery disease, the plaque in their arteries. They look and they find certain bacteria or inflammatory things in the plaque, in the arteries, and the only place that this could have come from was the mouth. It's the only place that they survive in. So how did it get from the mouth to the arteries? How did it get from the mouth to cause or contribute to artery disease?
Well, it looks simple to me. It goes into the blood at the mouth. It's a half a foot to the brain and a foot to the heart or something like that. It looks to me like a pretty short trip to me.
It's not that simple, but you know, when we check patients for gum disease, we check what we call their gum pockets. And that's the area between the tooth and the gum. And that's like a turtleneck around your neck. And that's the entry. That's the place. We want to make sure that gums are very tight and pink and firm. And if they have pockets with areas for the bacteria to get in, that's like an ulcer that's open for entry into the body. And they say if you add up all the pockets around your teeth, circumference-wise, it's almost as big as your whole palm. So if you can just imagine your whole palm being one big ulcer, and if your pockets in your mouth are ulcerated and diseased and filled with all the crap that you normally would find in bad gum disease mouth, the terrible odor-causing stuff, it's like having an infection on your whole hand that's not being addressed. And that's a lot of surface area, and that's where the entry to the body occurs, Helmut.
Right. Well, I mean, most of us, all of us probably, if we have a quarter, round like a quarter of infection. In fact, I currently have a little, something bit me. I hope it's not some bed bug and I have to burn down my house or something like that. But the point is, it's like a time, and it hurts. I mean, if that stuff doesn't go away for a week or two, probably everybody starts running to a doctor. An ingrown toenail, it's tiny, but it is infected, and an infection is an infection is an infection, and yet you have so much in the mouth, and only because it doesn't hurt, you kind of don't see it, a little bit bleeding when you brush. For some reason, people think that that's normal. They wouldn't say that when they're bleeding and comb their hair,
It's so true.
Yeah, and so there it is now. If it can cause something so bad like stillborn babies, even though that's super rare apparently, maybe it's only super rare because we're not checking all the time, I don't know, but let's just say it's the extreme, and it probably is. If it can cause a stillborn baby heart disease, well, what about the immune system down and the everyday flu, the bird flu, the swine flu, never mind the bird flu, the swine flu, the 4 times flu season we get throughout the year these days. Wouldn't that affect all that? The fatigue, the tiredness. I mean, if the soldier having to work an infection to make sure it doesn't explode, wouldn't the body be more open for anything else which hits it and be more tired and exhausted every day?
Well, of course, your immune system is trying to handle all the infections in the body, and if there's multiple things that it's dealing with, it can only do so much. There's plenty of studies on, and that we help them with their gum disease. They didn't even know they had gum disease. They'll say they're diabetics, and that diabetics' immune system is not great, and they're always constantly fighting the infections, and their blood sugar goes up and down, and their insulin's going all over the place, and we all of a sudden we take care of their gum disease problems. The body's fighting to keep that gum disease in check, but it can't. There's so many billions of bacteria, and it's fighting their diabetes, and it's fighting if they get a cut on their foot, and it's fighting the organs that are resisting themselves. All of a sudden you take care of the gum disease, and in a diabetic, let's say, all of a sudden they start saying, my sugar levels are so much better, I feel so much better. It's because their immune system isn't being taxed anymore to try to help with this gum disease that's really not going to be handled just by your own immune system. So, the helmet, 85% of the adult population has some form of gum disease. That's a huge amount of people. And most of them either have no clue or no one's telling them, but it's not right. They shouldn't be walking around. It's so easy to take care of, especially in its early stage. So let's not get the immune system taxed for your whole life. You'll feel so much better like you're talking about. And we can't really always relate exactly why they feel better, but some patients will say, my mouth feels cleaner, my breath is cleaner, I feel better. My wife says that she can kiss me now. I don't have that stinky mouth. All those things come to play when you get rid of the infection which is in your mouth. And, of course, your immune system for sure will be better off, and you don't have all those inflammatory things floating around in your body that can throw off your immune system and confuse it and make yourself, like you said, you can even get to the point where you can be tired from advanced gum disease. It's an infection, and infections really affect the body in many ways.
Right.
You're right.
Yeah, well, even if the gum disease, let's say, doesn't cause diabetes, doesn't cause heart disease, doesn't cause whatever it is, it, no matter what, like a domino effect, will contribute. So whether you have diabetes first or you will get diabetes easier because you have gum disease, in the end doesn't really matter so much. You want to take away what you can take away, and nothing is easier to take away than the gum disease.
Absolutely right. We're not saying it causes all these things. It just contributes, and if you tax the body from all different things, something's got to give. It can't do everything on its own, and usually it's the teeth and the gums and the bone that are not really painful. This type of disease is not like you have this sharp ache in your side where you might have appendicitis. People will let that go, and they shouldn't, because if we can get this disease in check early, it will really help them in their overall health of their whole body. And I think the physicians are finally starting to understand this and recommending to their patients, as I'm examining you, I smell something in your mouth or your teeth don't look right, you should go see your dentist, get your gums checked, and maybe that'll help you in everything else in your life as well.
In fact, Dr. Piskin, since you mentioned a physician, yes, I have talked to two physicians, and they tell me that especially if anything they treat doesn't respond as well as it should respond, they immediately go check the mouth and say go to a dentist and check it, because they have noticed that when gum disease is fixed, other infections seem to be easier to go away. And they have also noticed, both of those doctors, that there is a huge, they don't say they have done a study and it's all this scientific, but they themselves, out of their own feeling, say, you know what, when I see people who are 85, 95 and still kicking and out there and, enjoying life still, whatever that means at 95, but definitely not being bedridden at all, thriving still even, he says, you know what? I'm telling you, those people also have good teeth. For whatever it's worth is what those people tell me. Would you second that to a certain degree?
I would second that. Look, you have to have teeth to chew your food, and there's nothing like being able to mush your food before it goes down your throat, before it gets to your stomach, and being able to get to the point of having digestion start in your mouth, not in your stomach. You know, if you swallow big chunks of food, you have no teeth, or the teeth aren't working right, or you're uncomfortable, you have discomfort, you have teeth that are loose. You're not going to be able to do that kind of stuff. And I'm glad the physicians are starting to get on board with that. That's exciting. You know, one of the things is if you go in for any type of cardiac surgery, valve replacements, and the really advanced cardiologist will say, hey, before you can do any of that, go to your dentist. I need dental clearance to make sure that you have no infection in your mouth. Because if we do anything with your heart, anything in your mouth can affect that, and you do well, or you might not do well, unfortunately. So we need to get you healthy first in your own cavity. You might not do well because you're weak. You have a weakened immune system, and when you take the most dangerous operation you can possibly take, most likely, I assume, which is fiddling with the heart, you want to make sure that the supporting system of your body isn't unnecessarily weakened. That's correct. I mean, there are ways you can test system, a C-reactive protein. There's all inflammatory markers you can do blood tests on. You can do it before you have someone with a gum infection, gum disease, and then get them healthy. All of a sudden, all those blood markers are like, wow, those really went down. Where did that come from? We didn't do anything to you. No, it was the dentist that helped you. Oh, now we understand.
Wonderful, Dr. Piskin. We're running out of time here. Very informative and very candid. I'm sure people watching this video will, hopefully wake up. And maybe we're running only out of time because maybe I better get my butt to a dentist and check my gum disease. Bye-bye, Dr. Piskin.
Please do. Bye-bye now.